Affairs and the Executive Council, I'd like to welcome you all to the 7th installment of the Past Medical Histories lecture series. My name is Matt Carpinello. I'm one of the fourth-year students who's been involved with planning this event. And for those of you who may not be aware of what the Past Medical History lecture series is, let me give a brief introduction before I introduce our speaker, Dr. Adams. So the Past Medical History lecture series was initiated in 2011 by students on the Exec Council who are interested in hearing more from the legends of Georgetown School of Medicine. The goal of the lecture series is to hear from these professors in a different format. We've learned so much from them in the lecture hall and on the wards, but this lecture gives us a chance to learn from them about how they got into medicine and some of the most important lessons that they learned along the way. So moving on to our speaker tonight, Dr. Adams definitely fits the bill as one of the legends of Georgetown. After graduating from Georgetown, he completed his residency training at Georgetown Hospital, and he has since been a member of the faculty at the Internal Medicine Department, eventually assuming the role he has today of Vice Chairman for Education and Director of the Residency Program. Throughout his career, he has received countless commendations for his teaching, his dedication to teaching, including multiple Golden Apple Awards. He's been inducted into the Golden Orchard, and in the past spring of 2012, he was inducted into the Magic Society of Master Teachers, which is one of the highest honors that is bestowed upon faculty here at Georgetown. But on top of all this, perhaps Dr. Adams' greatest achievement is every March when the Internal Med Match List comes out. Year after year after year, Dr. Adams guides fourth-year students going into internal medicine in some of the most prestigious programs in the country. It is for these reasons and many more that Georgetown is very lucky to have Dr. Adams. So without further ado, Dr. Adams.
You guys hear me all the way up in the nosebleeders? Okay, I got some thumbs up. I want to move this up just a little bit. Well, thank you, Matt, for that introduction, and I want to thank the Executive Student Council and the Committee on New Initiatives for inviting me to do this. Really appreciative of being asked to do this talk tonight, and hope to give you a little background on some of the things that I've learned over the years. When Matt asked me to do this, he gave me an outline, and so he wanted me to talk about describing the lessons I've learned in my career, how I learned them, and how I apply these lessons every day when I see patients and teach students and residents. And he just said a minute ago that some of you want to hear about how people got into medicine. I was that kid who was the path of least resistance. I studied hard because I was afraid of my father, and, and he said, "You're going to be a doctor, a lawyer, or something like that." I was like, "Okay." So here I am. And some of you may have done the path of least resistance too, so you may know what I'm talking about. So I'm not convinced you're going to learn a whole lot tonight, but at least I can share a few experiences with you and maybe a few observations that will help you digest the wine and cheese. So I'm really proud to be standing in front of a group of high-functioning GT1s and 2s and some 3s and 4s and residents and faculty. Having spent my medical career here at Georgetown, I guess it makes me a GT27 now. I clearly recognize how a place that has the mission and the personality of Georgetown can really help form one's professional identity. And I hope you all learn that as you spend time here at Georgetown. It is a fabulous and unique place to learn and to train and to work. And I hope that you'll all learn that as you go through. A large part of forming the professional identity for me had to do with the great mentors that I had during my time at Georgetown, and a few of them are here tonight. So Dr. Eisenberg was my first chairman. He was a really diplomatic guy, very rational, and helped me to understand how to sort of seek help and enlist assistance when I needed to. Dr. Argy was my clerkship director when I was a student, and I actually became the clerkship director after he passed away. He was probably the first person to tell me how enjoyable it is to teach students, and particularly Georgetown students, and he was entirely right. Other great mentors that I've had include Dean Mitchell, Dr. Dennis Murphy, who's here with us tonight as well, Dean Kumar, and Dr. Chip Reed, and numerous other people who may not be in the room, but the other folks are here in the room with us tonight. And these great physicians, who are now, I call my colleagues, and I proudly call them my colleagues, anybody can learn from people like this because they model behavior. And I've been fortunate to see how they've interacted with patients, with students, with residents, with fellows, with colleagues, and I really realized the power of modeling that behavior. And unfortunately, I wasn't stubborn or stupid enough not to imitate them sometimes, because it really does matter how people interact with each other. So keep this in mind, particularly for the students in the room. You're going to be eventually the people who are teaching your students and your residents, and you'll be the folks who they're looking up to. And please keep in mind, remember to model behavior when you're at that level, because your students are definitely going to follow you. They're going to do what you do. They're going to watch how you do it and watch how you communicate with patients, and it's incredibly powerful to model this behavior. And between now and then, if you have the opportunity, attach yourself to these people that I've mentioned, because they're just outstanding physicians. Watch what they do, and you're going to learn a ton from them. So I'm completely biased about the excellence of Georgetown students. I was asking people if I should go with the hat or not, my Hoyas hat, but I'm going to keep it off for now. But I'm going to put it on. So I'm totally biased about how fabulous the students in the room are, but I'm right too. So that's okay. I remember walking home from walking back to the hospital from a Committee on Students meeting about maybe 10 or 12 years ago, and I was walking with Dr. Richard Holt, that I think many of you know. And Dr. Holt said this to me. He said, you know, in my experience, Georgetown students are either nice, very nice, really nice, or unbelievably nice. and for those of you who know Dr. Holt, you'll understand why I say this. Initially, I sort of chalked this a little bit up to the fact that Dr. Holt is probably the nicest human being I've ever met. And then I realized, you know what, it's not that. He's entirely right about this. We just have, and you are working and learning amongst a family of incredibly cool, caring, dedicated, and nice people. And this is not the norm, okay? I mean, you know, I visited a bunch of other fabulous medical centers, and they are fabulous, but there's something unique and special about what we have at Georgetown. And I want you to recognize that. And you know, as you go to see other medical centers, or maybe go on interviews, the fourth years are doing that now, you'll see what I mean. There's some great places around, but there are very few that have what we have here at Georgetown. Please remember that, because it really is a unique and special place. All right, let me talk about what I've learned from my patients. Your patients are going to definitely teach you a lot more than you expect. And I've certainly learned and grown by taking care of them, by listening to what they've experienced medically. And there's an overriding lesson when one cares for patients, and you're really going to learn how important trust is in the doctor-patient relationship. How much your patient will rely on you to do what is best for them all the time. And they're going to tell you things, and how much trust they place in you by telling you anything. And they will tell you things they won't tell spouses, church leaders, drinking buddies, anybody. They're going to tell you everything, and sometimes they'll be surprised at what they tell you. So you'll have this incredible amount of trust sort of thrust upon you, and this expectation that you're going to you respect that trust, and you know, I'm going to just encourage you to do that at all times. It's really unique and startling sometimes what you hear from patients. Fortunately, it's sometimes humorous as well. So I want to share with you a couple of patient correspondences that I laugh at every time I look at them. I have this little folder that I call hilarious stuff in medicine, and I just go through it probably once a week, you know, just to look at this stuff. So one of them is a patient who wrote to me before the EMR to request refills. And what he said was, I'm currently taking Lipitor for hedonism and Propecia for vanity. So this guy, I just wanted to schedule him like every third day. It's just so fun. So I refilled his prescriptions, and then I asked him, can I share this with my colleagues to get a kick out of it and you know, for a good laugh? And his response was equally funny. He responded, sure. As for the Lipitor reference, use it at will. I do some of my best work hyped up on NyQuil. And then he said, by way of introductions, use patient X, balding man of short stature and low self-esteem. Blood chemistry indicates a colloid of regular and normal blood components suspended in Crisco. You do not want to see a patient like this, right? So, you know, sense of humor is good when you invite patients to see you. Patients with a good sense of humor will definitely make long days much more enjoyable. I had another patient who had been about 12 years out from treatment for lung cancer, and he came in with his wife, and he said, you know, I'm a little upset. My pulmonary physician said he doesn't really want to see me for a whole year. And I think that's bordering on abandonment. And his wife looked at him and said, well, in that case, pray for abandonment. So again, your patients are definitely going to make you chuckle, and they're obviously the best reason to be here. I also learned a lot from my classmates. I remember as a student, particularly moving from second to third year, how tough classmates can be on each other. So again, I'm directing at the medical students in the room. There were a few classmates of mine who were considered gunners. So is that term still used? Okay, so
raise your hand.
Dr. Mitchell, don't take it easy now. So yes, I figured it was. So sometimes these gunners took a lot more grief than they deserved. And I learned that when I entered third year and I was paired with a classmate who was a gunner. And I didn't know this guy very well at all. And so as it turns out, he was a really nice guy. He was a great teammate. I started out on surgery, and particularly on surgical rotation back then. It was really important to have a good sort of team. And this was a guy who was willing to go above and beyond to help a classmate. So I learned, and I would encourage you, please give each other a break. Give each other a break, right? Because you're going to hear things about people, and I'm not sure how much all of this is true. Give each other a break. You might pick up a lifelong friend. You might certainly learn how important it is and valuable to work in a really collegial environment. So give each other a break. I'm going to come back in a few minutes to one more patient-related lesson that I'm going to describe. But in the meantime, I think it's important for me to describe how a few of the many lessons I've learned from my students and my residents, because you guys teach us as much as we teach you. I promise you that that's the case, and I see some heads nodding from the faculty. So I was on rounds. I was doing teaching rounds one month, and I was on rounds one day with my inpatient team, resident, intern, acting intern, a couple of third-year students. And we did what we normally do, which is go in the room, you talk to the patient, you ask how you're feeling, how he's feeling, perform an examination, and a lot of times this almost ends the whole thing, and all the white coats kind of shuffle out of the room, right? So my resident, before we did the shuffle out of the room, she sat down on the chair next to the patient and said, Mr. Smith, or whatever his name was, do you have a good understanding of what's going to happen with you throughout the course of the day today? And the guy looked at her and said, wow, nobody has asked me that question since I've been here. This guy had been in the hospital for about 3 weeks. And it's obviously a stressful time and everything. And he was so incredibly appreciative that the team didn't simply evacuate the room without kind of going over what was going to happen. So she went on to go through the details of the day for the patient, including tiny details. When the nurse was going to come in to get vital signs, who was going to draw blood, how he was going to get to radiology, whether it was going to be the wheelchair or the bed or the gurney, and went through every little detail so the guy knew exactly what was going to happen. So it was incredibly powerful and a great example of professionalism and patient-centered care. And the guy was so incredibly appreciative because most days he sat there nervous about what was going to happen. And this resident, she was just fabulous. She sat down and went through every little detail, stuff that you might not even think of. When's your food going to arrive? So I thought it was a great example. So the next day, we did rounds again, and the third-year student did exactly the same thing for a different patient. Sat down, went through everything. The patient, she was incredibly appreciative, just like the guy the day before, because again, nobody had really sort of gone through all those little details of what happens to you when you're an inpatient. So I guess the lesson that I would say about that is, and so I asked the resident actually, and she said, no, I didn't prompt the student to do that at all. The student just watched this modeling of behavior and did the same thing the next day. So, again, the lesson is you can learn from anybody. I've learned from students, I've learned from residents, I've learned from fellows, I've learned from faculty. So, don't be shy to learn from anybody who's doing it right and knows how to take care of a patient, because we can learn from everybody in the room here. I've also learned some lessons on what not to do, one of which I picked up from my former residency program director. So I suspect there are some of you, but not a lot of you in the room, who know who my program directors were when I was an internal medicine resident. I had two of them, one of them for a very short time and then the second one. So the first program director I had was a man named Dr. Dudley Jackson. Dr. Jackson was one of these sort of heroes of medicine, and he was in a lot of ways similar to his successor. And I'll tell you what I mean by that in a minute. Dr. Dudley Jackson was a hematologist. He was a subspecialist. But everybody that I talked to who had been at Georgetown for a long time said, this guy is the best internist that Georgetown has ever seen. And I learned after a short period of time that this was probably true. This guy was brilliant and just a great man. And I'm proud to say I was the last student who was ever interviewed for the Georgetown medicine program by Dr. Jackson. So he was brilliant, he was a great educator and a really nice man. So his successor, let me tell you a little bit about him. He was a relatively new faculty member as I was a fourth-year student, and was already recognized as a great educator and someone who clearly was going to make his mark on Georgetown. But he made the mistake of forgetting to bring one thing to Dr. Jackson's office one day, and that was restraint. So he went into Dr. Jackson's office and said, medicine residents here are pretty good, but I think we can probably, get some higher caliber people into the program. So the response was immediate. Dr. Jackson looked at this person and said, congratulations, you've now become the internship director. You're going to do all the recruitment for me. Does anybody want to yell out who that person was? It was Ray Mitchell. So I would love to have seen the look on Dr. Mitchell's face when he was assigned that job. That job, we would call an associate program director now, but I think the title was internship coordinator or something along those lines, where Dr. Mitchell's job was to make sure that we brought in good people. Again, the lesson is be careful what you ask for, because you just may get it. And so Dean Mitchell had to put up with me and a bunch of other knuckleheads during his tenure as program director. Because sadly, Dr. Jackson died a few months afterwards on the tennis court. And so the only positive thing that came out of the tragic death of Dr. Jackson was that Dr. Mitchell took over as program director and really brought a ton of energy to the role. So that leads me to my next lesson, which is please be kind to your dean and your program directors. I thought that I was, when I was a resident, I thought I was a generally okay resident back then. I thought I treated Dr. Mitchell reasonably well for most of the time, at least until my chief resident year. Fortunately, one of my chief resident colleagues is here tonight, so I can pick on him a little bit too. So during the chief year, my chief colleague and I, Eric Anderson was my chief colleague, we came up with a plan to help with the recruitment. And one of the ways we wanted to do that was to show off all of our affiliated hospitals, to maybe, take a video camera and film the residents having fun and teaching and learning and all that at the affiliate. So that's what we did. Sadly, we were idiots. We were just complete idiots, because we brought a video camera into the VA. And so, just like nowadays, the VA leadership at that point was under a lot of pressure to avoid scandal and to make sure they were doing things right. So they see these two knuckleheads walking through, three knuckleheads, I think. I can't remember if our third, maybe it was just the two of us. So we're walking through the video camera, and they probably think we're from, 60 Minutes now, or probably TMZ or something, right? So the VA security made sure our next phone call came from behind 16 inches of plexiglass, bulletproof plexiglass. And we were begging our program director, can you get us out of here? So, again, just complete idiots. So Dean Mitchell was good to us. He eventually got us out of there, but I think his first thought was to replace his chief resident. So again, think before you act. Don't be idiots like we were, and be kind to your program director and your dean. Finally, a great thing I've learned is probably going to be contrary to what you're all going to hear from other physicians and colleagues, but I want to make the case that I found it extremely valuable when used properly. I'm going to share something with you which, a good number of you probably already know, but the first part of this relates to a patient that I've been managing for about 15 years, and he's just one of these great guys who you want to see on your schedule because he's just a really nice guy. He sort of chats about, life. He's got a great sense of humor. He's often opened up and described why he loves what he does. This particular patient is a guy who has been a teacher at one of the local schools in DC for 35 years, loves working with his students, and is just a guy I just have such a good time talking with. And so last year, he began having headaches and eventually got brain imaging and was diagnosed with a high-grade glioma. And so I got him set up with the neurosurgeons. He began treatment with radiation and chemotherapy. And I then started setting him up to see me as often as he and his wife wanted, which ended up being about once a week. And these appointments were much less about medical management than simply helping him through, getting him through treatments, through the depression that he was having, and reassuring him that his physicians were really top-notch. And his wife told me that it was really therapeutic for him and really helped improve his depression just by bringing him in and talking to him about what he was going through. And it really did help him. So now is what I'm going to share with you. Fast forward until April of this year, when I got the same diagnosis that my patient did. So I got set up with surgery and radiation and chemotherapy, and the family left and everything got settled down. And I had my staff contact patients to tell them I was taking some medical leave. And I thought I wanted to contact this guy myself directly. So I contacted him and I told him, look, I'm going to be taking some medical leave and not seeing patients for a little while. And I told him why. And that's the part that people will tell you to avoid doing. But keep in mind, I've heard from a lot of people and a lot of colleagues, keep patients from getting too close. You don't want to share too much personal information. And I would agree with that for the most part, to be honest with you. But this was a particular situation where I thought it may be therapeutic for this patient to hear this. So again, I'm not going to suggest opening your medical file to your patients by any means, but this patient was struggling so much with what was going on, and after I told him this and kept bringing him back in to see him, his wife said it was the most beneficial thing that had happened to him since his diagnosis, just the fact that he and I could sit down and talk about it. So again, not the usual beaten path, but something that I thought was going to be helpful for this guy. His wife told me that it really was, and really helped improve his depression again. So I guess the lesson I learned from this is that sometimes, even though it's not what people are going to tell you is the best thing to do what's best for your patients. If you think it's going to be best for your patients, it's okay to do it, even if it's not what people would commonly say is the right thing to do. And in this case, it really was helpful, and this guy is so appreciative and probably was therapeutic for me as well, frankly. So I'm going to sort of close it down a little bit now. So if I were to list the lessons learned that I've learned, I'd say this: listen to your mentors and model their behavior, because you have great mentors here at Georgetown and just fabulous people that really are going to do the right thing, and they're great people to follow. Select patients with a good sense of humor if you can, right? Have your hilarious stuff in medicine file, because they really do crack me up. Georgetown students are the best, and I mean that. I just had so much fun and learned a ton working with all the people in the room and all the people in years past, and you guys are the best. There's no question about it. And I'm not the only person in the room who's nodding their head right now. Don't be too cool to learn from everybody. Learn from your students, learn from residents, nurses, fellows, the maintenance staff, anybody, because you can learn from anybody, especially about the interaction with patients. Be kind to your dean and program director, okay? Please remember that one. Dean Mitchell has learned, be careful what you ask for, because you just might get it eventually. And do whatever you can to help your patients, even if it's something that seems a little bit off. Keep your patients first in mind. I have to add one final piece of advice, and that is live like an Italian. Right? So I know Adams doesn't sound Italian, but my mother's an Antonelli and a Ganella, and my father is a Manzi, And so apparently when the families hit Ellis Island, they looked kind of freaky, and we became Adams. So whatever. That's but you learn a lot growing up in an Italian family about how to really enjoy life. So here are a few tips for living like an Italian. Enjoy every meal, right? And Dr. Murphy will tell you this because he was recently in Italy. Every meal in Italy is an event. And when I was growing up, every meal was an event. The entire family was there. We started at 10 in the morning, we finished the next day sometime. So it's just fabulous. Enjoy every meal. Number 2, hug friends and family generously. It is a great thing, and again, incredibly therapeutic. Sip some red wine, which many of you have already done tonight, which is great, but don't think you need to pay $50 for a nice bottle of wine, all right? Maybe I'm cheap, but you know. Live as close to the family as you can. We grew up with a family down the street, and it was just great to have family close by. And the other thing that was really valuable, I think, is bring your closest friends into your family. The kids that grew up with us were always at our house, probably because my mother was cooking all the time, but they became family to us, and they just, they loved being around. So, and finally, live every day as if it's your last. So thank you for being here tonight. I really appreciate the attendance.